Good morning. My name is Mandy Holstein. I own Power of Wellness. We're a family medical clinic here in Ketchikan. I don't typically get online and share information via video. To be honest, even though I'm of the younger generation and I'm supposed to be able to figure out how to video stream and all this stuff, I couldn't figure out how to do it. So I said, heck with it. We're gonna get a video out there to the public on my phone. So forgive the poor quality of rendering here. So I know everybody in the community has heard information coming from out of state, on a national level, on a state level. They're about the COVID-19 situation. There's a lot of fear. And it's understandable. So I wanted to publicly address this from a healthcare perspective, and this is very off the cuff. So, and it's probably going to be a little bit disorganized, just so that you're aware. If this isn't the best time to watch the full video, that's okay. This is specifically just designed to be a public service announcement of sorts, and also an announcement to our patients of Power of Wellness, so that people have kind of an idea of, you know, what are we as healthcare professionals thinking? What are we doing on a community level? What can you do from a community level to help reduce the spread of this, and be precautionary and prepare but not panic? That's the really important piece here. It's important to focus on prevention and not panicking, okay? So I'm going to talk very off the cuff and candid about this issue. So as a health clinic, Power of Wellness, a couple things that we have decided to implement is reducing any unnecessary travel for our older clients, preferably over the age of 60, although if it's an unmedically necessary visit, what we're recommending, older adults, maybe even over the age of 55, consider about traveling into your healthcare provider. As you're very aware, there are a lot of sick individuals, not necessarily with COVID-19, but just generalized illness, that come in and out of the doctor's office. And despite our best decontamination efforts, we're not always successful in reducing that cross-contamination, not only to our patients, but to ourselves. So I would say personally, you know, having my own parents that I'm giving advice to, the model that we have here is treat every patient like they were your family, okay? So from that perspective, I would say if you do not need to go and see your healthcare provider, if it's an elective visit, my recommendation personally would be not to go, okay? Your healthcare provider will understand. Now, that's not to say if the appointment is necessary, blood pressure management, you know, diabetes management. There are things that are medically necessary that could affect your health long term. So if you have any questions about whether or not you should go in for that appointment, you should be reaching out to your provider and calling their office and saying, hey, you know, I'm of a certain age, I might have the cough or the sniffles, you know, something like that. Is this appointment really necessary? Should I come in or should I reschedule? That is a very good way to do your due diligence and to prepare and try to prevent not only you contracting some type of illness, maybe not even COVID-19, but there are many other viral illnesses out there that can cause immunocompromised individuals harm, okay? Influenza A and B, there's a lot of comparison that's being made right now between COVID and the flu. There are differences between the two. However, what we're finding now is that younger people are getting a less severe form of the illness. Not all young people, I'm not saying that at all, but those with healthy, strong immune systems, we're noticing they may have totally no symptoms, or maybe even symptoms that are of a mild cold, or symptoms of a flu. Obviously not a life-threatening situation. The outcome with our immunocompromised individuals is very much similar to what happens when they come into contact with influenza A or B. Influenza A or B in a young, healthy individual with a normal immune system usually is okay. You know, I spent 3 days in my bed about a month ago and I swore I was dying, and that was the flu. But I bounced back after several weeks without antibiotics or anything else. And so, you know, I consider myself a young, healthy person, and I had no problem. Now, my mother, who's almost 65, still very healthy, but her age alone makes her at greater risk for things such as pneumonia. If I was to give that same virus to her, it would be uncertain exactly what her outcome would be, whether or not she would develop pneumonia, would she need antibiotics, would she need a hospital stay. So we're seeing a lot of the same transmission and outcomes with COVID-19. Now, I do realize that there is kind of a mass national level of concern and fear that's developing, and it seems to be snowballing a little bit as of the last, I would say, 72 hours, okay? And so I want to and again, I'm rambling a little bit, but I kind of want to abate the fear slightly. This is a virus that is spread very similar to influenza. It is contact-based, okay? It is droplet-based. You cough, you sneeze, you contaminate your hands, you contaminate surfaces, you touch a doorknob, you touch a shopping cart, you know, you shake somebody's hand. You don't think about how many surfaces you're actually touching during the day and what type of bacteria, not just COVID-19. We're talking about influenza, we're talking about simple viruses that are common colds, we're talking about hand, foot, and mouth disease, we're talking about some gastrointestinal diarrheal infections can be transferred like that with fecal particulates that are fairly microscopic. The list goes on and on and on. MRSA, staph, I mean, again, it goes on and on and on, okay? But you don't realize how many surfaces you're actually touching, and then to have the potential transmission to your mouth, your nose, your eyes, you know, touching a chip or a piece of candy or whatever that might be, that contact to now the mucous membranes where that can be taken into the body, you know. So it's just very good to be aware. Be aware of the surfaces that you're touching. Practice good hand hygiene. There's this new term emerging called social distancing, what I heard of at least 6 feet apart. All of those things are general good practice to separate yourself from any potential contamination, okay? I think the good thing that's come out of this entire COVID-19 is everybody is becoming hyper vigilant and hyper aware of all of the germs that surround us on a daily basis because there's been a large focus put on COVID-19. And so now everybody is kind of assessing, okay, what am I touching? What potential do I have for contaminants? You know, it's kind of bringing awareness back to that. So as far as the hand sanitizer being in short supply, I have nothing to say to that. I can say that healthcare professionals are also experiencing shortages with supplies that we need on a daily basis to keep our communities and ourselves safe. So that to me is one of the most concerning factors. I was at Walmart here in Ketchikan yesterday. The entire shelf of hand soap was sold out, and I just went out of curiosity to look to see what was there. To me, it was comical. There were two, I'm not going to mention the brand name, but there were two very natural preparations of hand soap, and they were the only ones that were not completely sold out. They were the only ones on the shelf left, which is comical. Antibacterial hand soap is not the answer, just so you know, okay? It's warm water, it's the friction of bringing your hands together, and that surfactant, that soap, it could be a bar soap, it could be natural soap, it could be antibacterial soap, it could be any of those soaps. But the act of using that surfactant on your hands with the friction, getting under your fingernails with the addition of warm water, that's what helps maintain that hand hygiene. So if you want to know what my professional opinion is, it may or may not be scientifically founded, so please don't quote me, don't comment, hate comments. But the more you use hand sanitizer, just be aware after about the third use, you start developing a film on your hands, and that you will want to wash off with warm soap and water. So bar soap's okay. Use bar soap. The Dial soap was not sold out at Walmart last night. So if you are that concerned, or if you are in desperate need of soap, feel free to use the bar soap. That's just perfectly fine. And then in terms of going back again to what Power of Wellness is trying to do on a community level to try to reduce the potential for illness spread, not just with COVID-19, but on a general level. We're urging our older clients, please call us first instead of coming in for your regular scheduled appointment. We're planning actually on being proactive and initiating those phone calls as well. If you are sick, okay, here's the elephant in the room. If you are sick, we've had a lot of this, and rightfully so, okay? We need you to call first, okay? Call first.